Hi everyone, I hope you're doing well. So here I am, and it's been a while since I posted my last video, and I just wanted to get an update about my procedure, like orthodontic treatment, and how it goes after my surgery and so on. So here I am, a year later. Like my surgery, it was on the 3rd of January 2022, and now it's the 3rd of January 2023, and it's been a year. And I just wanted to talk briefly about how I feel, how it's been, and what is going on right now during my treatment journey, like, and so on. So, like, after the surgery, you had some videos of mine where I posted, like, just after the surgery, some photos and videos, and then I also talked up to like 5 months post surgery or something like that. And right now, it's like it's been a year after the surgery, and what I can tell you. First of all, the numbness. So, it came almost like back almost like 97% or 96, something like that. I still have some numbness here because I had genioplasty, and I have a little bit of numbness in my gums, like here and somewhere here, but that's all. Like beyond all these facts, just like my sensitivity came back, so I can feel all these parts of my face, and it's completely okay for me now, and it's functioning okay. When it comes to other points, like the swollen or the aesthetic issues and so on, so I can say that 100% I am content and satisfied with the result of the surgery. And as you can see, it's like the swollen is gone. I would say that it's gone for also like 90%, maybe 95%. Still there is some soreness in my face, but we are aging, and also you like sometimes you don't eat as you should eat and so on, so you get more water, less water in your body, and so on, so on. So it also just reflects on your body and on your face. But right now, I would say that my face is pretty well, and I like how it looks and so on. Let me show you. So, so from the profile, and if I look like straight, so it looks like this. Nobody, I mean, I haven't been home for a while, and eventually when I came home to see my old friends, my family, and so on, and I didn't actually tell about the surgery to a lot of those people. And when lots of my friends who I haven't seen for ages, they saw me, they were like, something changed. But we don't understand what, but something changed. You look prettier, you look better, and so on, but they don't even understand what changed. So that's why I'm talking about the thing that, yeah, you can definitely have the surgery. It's gonna just improve your face, make it more balanced, but it's not gonna change you for 100%. Still, you're gonna be recognizable. People gonna recognize you anyway. Yeah, so I'm glad with my result. Uh, let's talk about chewing as well. So I can chew everything that I want right now, like nuts, apples, I don't know, some other kind of fruits, meat, and so on. Like everything that I want, I can chew at the moment. I mean, I was afraid of chewing nuts, but it's okay for me now. Like completely okay, I can chew it. The only problems that I'm facing right now is that I cannot open my mouth as wide as I wanted to bite an apple. Like I still can bite it, but it's gonna be a small bite. It's not gonna be a big bite. Maybe I am a little bit more like trying to be more protective and trying to be um, more careful with those stuff. I don't know. And if I try harder, I can just bite it bigger. I don't know, but still, I'm trying to take it slower than maybe it should be. So I can bite an apple, and I do it, but my bite is smaller because, and for example, if I need to open my mouth, I can open it not for 3 fingers, but 2.5 fingers for a while, for now, at least. So, and I hope it's gonna be 3 fingers later. What else I wanted to tell you about chewing? I told about the sensibility also. I talked to you like it's okay right now. And I'm sleeping better, like 100% I'm sleeping better. I sleep mostly on my back, and it just affects all my life quality and everything, just perfect. I don't have any sleeping apnea or any issues with my breathing. Like I can breathe totally fine, and now I do understand the loss of consuming the oxygen before. Now, I mean, I consume so much oxygen, and I feel like I fully breathe because before it wasn't like this. And also, what I can tell you, it's about my problems with my joints. I had some problems with my joints before. They were aching. I was hearing the clicking sound of the sound all the time and so on. It's all gone. I don't have joint problems or joint pain right now. I have, like I used to have from time to time when I just started orthodontic treatment after the surgery. I had some joint pain, slight joint pain, but it was just because of the change in my bite, like changing the position of my teeth and so on. And doctor, my orthodontist warned me like you might have a slight joint pain from time to time, and it's completely okay. It's not something like wrong or some problem there. It's completely okay. So yeah, I had some pain in my joints, but now it's completely okay. And let's come to orthodontic treatment. So as you can see, I don't know if you're seeing it or not, I'm having aligners at the moment. Yes, I started the aligner treatment, and I can say that for me, like you can choose whatever you want. You can go to braces treatment, you can go to aligner treatment. It's up to you. It's your choice. In my case, I had some kind of phobia after the like unsuccessful braces treatment. I was talking about it in my first video, so I decided that I don't want to go on with braces anymore. I hate them. So I was suggested to go with aligners. And I said, yeah, let's start it. Let's do it. So yeah, right now I'm having aligners. You can see attachments on it. You can see it here and here as well. And I started to wear them in June. So it's been like how many months? June, July, August, September, October, November, and December. Like about 6 or 7 months, something like that, I guess. Yeah, and it's okay. It's completely okay because right now I don't feel like like when you're wearing bracers, you for a long time, that's what I experienced before, like you're ruining your teeth and so on. I don't have that feeling now. Like I can take them off whenever I want and go and brush my teeth, or I can just take them off and eat my food normally and then just brush my teeth again and put them back and so on. So it's quite easier for me than wearing bracers, but it's only for me. It works for me like this. So it doesn't mean that for 100% you need to go on with your orthodontic treatment only using aligners and bracers are not for you, or vice versa. I don't say that. I just say that you need to see the doctor and just to communicate and negotiate with your doctor about the possibilities, what you can do and what you shouldn't do with your treatment. Yeah, so I've been wearing like these aligners for a couple of months and I feel okay about wearing them all the time. Yeah, you can hear that like my speech is not like normal. Sometimes my tongue stucks and so on, but it's, like I got used to it. Like, yeah, I can feel that my pronunciation is not okay when I'm wearing the aligners, but it's completely okay. It's not like, that it's not that noticeable actually. So it's okay. And people around me, they also like when they notice that I'm wearing aligners, they are okay. They don't say like, oh, what the hell you're wearing or something like that. It's completely okay. And of course the aesthetic just side of this problem, it was really important for me not to wear bracers again, since I'm dealing with a lot of people every day and I care about my appearance as well. So I really wanted to have something invisible, like something that is not so noticeable and people would not stare at my teeth like this, like, oh, saying what you're wearing on your, what you have on your teeth or something like that. So bracers for me, they weren't an option, and aligners is just perfect solution for me because I can wear them and nobody sees them actually. Yes, they notice it, but not at the first time, but maybe later and so on. So for me, it's better. And how my treatment goes with aligners is different from bracers treatment. I would say it like this. It depends on your case, like what is the position of your teeth and how bad it is and how complicated it is and so on and so on. So it just depends. So that's why I always say you should see the doctor and talk with your doctor about the things that should be done with your teeth, and you should discuss the options. And if your doctor says something like, yeah, we can do aligners treatment and we can do both aligners and bracers treatment. It's up to your decision. If I were you, I would say aligners for 100% because it's more expensive. I agree with that. But for me, in my case, it's more convenient, it's easier, and it's better. But it's for me. So in your case, you just decide whatever you want to do. Like all the options are okay. Yeah, so, and I've been wearing, as I said, I've been wearing my aligners for a couple of months, and the only struggles that you have with your aligners is that you need to take them off and put them back whenever you finish with your food and drinks. Like you cannot wear them when you drink hot drinks or something, just like except the water. You cannot drink anything while you're wearing them. So like imagine you want to drink coffee or tea, or you want to go on a dinner with your friends or lunch, whatever it is, it doesn't matter, or you want to chew gum, so you need to take them off, and you're allowed to take them off like in total for 2 or 3 hours a day. I was trying to keep it like 2 hours every day, not more than 2 hours. And at first it was a little bit struggle, like because you try to wear them, but at the same time you forget about them and so on. But after some while, it was completely okay for me as well. So I was wearing them all the time without any struggles, any problems, and so on. Yeah, right now it's not a problem for me anymore. The other thing, when they first apply attachments on your teeth and you wear your aligners for the first time, it's kind of tough because your teeth are not used to it and you're not used to it and so on. So at least in my case, it was like my doctor just helped me to wear them, and then they were so tough. And it was really, really hard to take them off. I was like, every time I was struggling with it, and I was like, oh my god, it's gonna be like every time. But my doctor, he told me like it's gonna be okay after a few times, like you're gonna wear them pretty well, and taking them off and putting them back, it's gonna be completely okay. So at this moment, right now, yeah, it's completely okay. Like I can take them off easily and I can put them back easily. Let me show you. Please don't be disgusted by these movements, but I just wanted to show you. Look. So I took it off. It was quite easy. It is the same with your upper jaw teeth. And then if you want to put it back, voila. So it's quite easy. But at the first, it wasn't like that. I've been struggling, like in front of the mirror, trying to take them off, trying not to ruin my attachments, trying not to break them, and so on. So it was quite hard, but after some while, it was easy. And yeah, as I told you, I'm totally content with it, and I love it, and I'm in love with them. Like they look perfect. They are doing their job, so my teeth are aligned, and the position of it, my occlusion, my bite is getting better and better and better every time. So I think, as we talked with my doctor, I still have about 3 months to go with the treatment, but it doesn't even bothers me anymore, like, I mean, I'm totally okay wearing them. Like they are part of my life right now. It's not something that annoys me or bothers me. So like I'm okay. I'm completely okay. So I'm not like somebody who's saying like, please, please, let's just take them off as fast as we can. No, I'm okay. So it goes as it should be. That's all. I mean, this is the main profit of surgery is the first approach. When you first get the surgery and you get the main effect of the surgery and of the treatment, like your jaw's position is right, and aesthetically and functionally you have already the result, and with the orthodontic treatment you just correct the result. So it's like corrective treatment, at least as it seems to me. So you have your balanced space, you have your result, and there is little more to go with orthodontic treatment, and after that you're done. So for me it's like enjoyable part. It's not something like, oh, I have 1 year or something like that to go with orthodontic treatment and so on. No, for me it wasn't like that. It was like, yeah, I have great result with the surgery, so I need to keep it, and I just need to improve it with a corrective orthodontic treatment. It was like this, completely like this. So, and right now, after the surgery, like the main profits of the surgery, as I told you before, like chewing, just solution of your joint problems, solution for your breathing issues, solution for your it might also affect your problems like psychological problems, or if you have some issues with your anger and so on. It also helps you. Let me explain why. Because When you don't sleep enough, like if you have problems with your jaw, you might have breathing issues. It leads to sleeping apnea, like because when you sleep, you don't get enough oxygen and you sleep with your mouth open because you are trying to compensate any way you can. You're trying to compensate that lack of oxygen. But think about it like this. So your breathing way, like breath way, it's like this when it should be like this. So it doesn't matter even if you open your mouth or close it anyway, like it doesn't matter because eventually the oxygen it goes through this way, and if it's too narrow, so you don't consume enough oxygen. And if you don't consume enough oxygen, your brain is not, getting enough rest. So, and you have problems with your sleep. So, eventually, when you wake up in the morning, you wake up tired. You don't get enough of sleep. And if you wake up tired, you can have bad mood. You can be more tend to have anger issues and so on, so on, so on. So it's like or psychological problems or depression and so on. It's so related. And yeah, so I don't have anything like that. Before, I remember I used to wake up in the morning really tired and angry, and like I didn't have even the reason to be angry. I was just angry in the morning. Yeah, now you would say that it just depends on your mood and so on. It might be, but in my case, it was like just directly because of the jaw deformation and lack of oxygen in my body. And as I got enough oxygen in my body and I sleep well now, so I don't get tired and I don't wake up tired already in the mornings. And I get more energy, I get more oxygen, and that oxygen also helps me to burn extra fat in my body. And I would be happy to share with you that within this 1 year, I lost in total about 17 kilograms. Yeah, it's been a lot. Yeah, of course, I was just following some rules like eating healthier and so on, not consuming sugar at all and so on. But at the same time, I was doing that before, like before jaw surgery, but it didn't help me anyway because I didn't get enough oxygen to burn that fat. But right now, it's so much easier to follow these rules and just keep going, like keep losing weight in a right way without like that much of effort to spend on my journey, on my weight loss journey, and so on. So now it's like in total, it's like minus 17 kilogram, and I'm just so happy for that to just to gain my dream body and to be the woman that I always wanted to be. This surgery, it's not only about the surgery, it's about your life quality. This is the thing that I'm always saying. Really, it's not about the surgery itself, and it's not about the appearance. So if you want to go and just fix your face because you don't like it only aesthetically, please don't do it. Really, don't do it. Because this surgery, first of all, it helps to regain your functions. Like we're doing it for health. First of all, it's for health. And as a benefit, or something like extra to the surgery, it's aesthetical, also improvements of your face. But if you want to do it only because you don't like your chin or you don't like your jaw or something, please don't do it. It's really hard surgery. It takes months to recover. and it's so expensive, and at the same time it cannot go without any orthodontic treatment. So in this case, if you want to have beautiful face, just because of that, don't do this surgery, please. Like, you eventually you're not gonna be satisfied with the result, because first of all, and the main idea of the surgery is just to gain your functions, like to help to improve your health. And when you get the health that you needed, like you are healthy again, you can improve your life quality. You can sleep well, you can breathe well, you can just work well, and so on, so on, so on. So it's all about your life quality, and it's not about the aesthetic point of view. Yeah, as a bonus, you're gonna have balanced and beautiful face, but it doesn't mean that with the surgery you're gonna be completely new person, or you're gonna be like a superstar or something like that. No, it's not like that. So yes, I am content, and I'm so satisfied with the result. I love the result. I love my face now, but it doesn't mean like that I was going through all these procedures and so on, all this recovery process just because I wanted to have better face. No, it wasn't the first. Like, first of all, I was doing the surgery because I was having some health issues and health problems, and I knew that without the surgery I cannot fix them. That's why I did it. And the recovery period is long and it's expensive. So, like, do you need all these sacrifices just only because you want your jaw to change? Like, you have aesthetical problems and issues with your face? I don't think so. So please, just like before considering the surgery and thinking about doing it, just think about the fact why you want to do it. If it's like health issues, yeah, go directly and do it. I no doubt just do it. Just have it done as fast as you can, because it's gonna improve your life. It's gonna help you a lot. But if it's only aesthetical point of view, I wouldn't recommend it still. So yeah, and as I say, it's not about the surgery, like, right? So like your life quality changes. I First of all this recovery process, like you are not able to eat for 2.5 or 3 weeks straight, and then you're going to chew food for another 3 or 4 months, and after that you are starting to chew your food and so on. This is a recovery process and it's long. So of course, first of all, it makes you a better version of you, and a stronger version of you, I would say. The second thing, that you, as you start to consume more oxygen, you sleep better, you feel better, you walk more, uh, you communicate with your dearest and nearest more, and you spend more time, and you are more energetic and active than you used to be. So it's also about life quality, and your body changes as well. Not just because like you start to lose weight or something like that, but your skeleton position changes as well. So it's going to be more straight because this part is fixed. And with orthodontic treatment, you also fix your teeth. So, and if you ask me also, how would I know if I am suitable for surgery as a first approach or not, I would tell you, you need to see the doctor. You need to see the doctor, and you need to talk to him. And my advice to you as well is, you remembered at the first video I was telling you to grab your x-ray scans. Like I did it, like I had my x-ray, it was like panoramic and cephalometric x-ray scan. So you can just have it done, and you can take it to the doctor, Like you can take it to the orthodontist, and you can take it to the surgeon. It doesn't matter, it should be my surgeon, like who performed my surgery, or the other one. But it's going to be helpful. Like at least the doctor can see it and can see the measurements and occlusion and so on, and get the decision based on it, like if you are suitable for surgery as a first method or approach or not. I like it. But would I say that the other approach is the worst one? No, I wouldn't. It's also a good one. Like you get the orthodontic treatment first, then you like preparation of your teeth for the surgery, then you go to the surgery, you have it done, and you continue for a few more months with orthodontic treatment, and you finish. So, I mean, I was suitable for surgeries first because I had orthodontic treatment before, but maybe you might be also suitable even without orthodontic treatment. The doctor needs to see it, and doctor needs to decide on it. I am unfortunately I don't have any idea of the criteria whether you're suitable or not for surgery as a first approach. Yeah, so it's been a year, and I decided to film it today, like the small talk with you. I say it's small, but it's already like 30 minutes. I'm sorry. Yeah, so guys, as always, there were a lot of people talking to me, reaching me after my videos, and asking me a lot of questions about the surgery and so on and so on. So I'm always here to help. If you have some questions or something to share with me, please don't be shy. Like you can share with me whatever you want, and talk to me about the about I don't know, your thoughts or your intentions to have the surgery done and so on. All right. So yeah, I think that would be all for now, and I promise I'll try to also just upload some videos about my recovery, more in detail about the food, more in detail about the how I was keeping my teeth cleaned and so on and so on and so on. So I'll try, I promise. Yeah, I think it's all for now. Have fun, have a good time. Happy New Year, by the way. May all your wishes come true. And I hope everything's gonna be okay, everything's gonna be wonderful and amazing in your lives, and you're gonna have your dream jaws bite and face, and you're gonna be healthy, and everything gonna be the way you want it. All right, so don't be afraid of sharing your thoughts with your doctors and talking with them, because the main idea of the doctors is to help you. So please don't forget about it when you reach the doctors, and or when you disagree with your doctor. Just remember, please, that the doctor's main idea always is just to help you the best way they can. And if they say that it cannot be this way, it should be the other way, please listen to them, because they knew at that moment better, since they are doctors, and they are dealing with this kind of issues every day, let's say. All right, so have fun, happy new year, merry Christmas, and I wish you luck and all the best in your lives, and I'll be uploading some videos soon. Bye bye.